Bismillahirrahmanirrahim. I'm Wania Sadiq, working as a lecturer in Department of Health Professional Technology, Faculty of Allied Health Sciences in University of Lahore. Today my topic of discussion is types of anesthesia, in which we will discuss the definition of anesthesia, the types of anesthesia, which are further divided into general, regional and local anesthesia, and the different types of anesthesia, their dosage, their indications. So let's start our topic today. Let's first discuss anesthesiology. Anesthesiology is making a surgery painless. The definition of anesthesia is the triad of sedation, unconsciousness, analgesia and muscle relaxation is known as anesthesia. Moving on to types of anesthesia. There are three types of anesthesia: general anesthesia, regional anesthesia and local anesthesia. Regional anesthesia is further divided into spinal and epidural anesthesia, and the local anesthesia is further divided into topical and infiltration anesthesia. General anesthesia further divided into total inhalation anesthesia, TIVA, total intravenous anesthesia, and balanced anesthesia. Balanced anesthesia is a combination of inhalant anesthesia, injectable anesthesia, and anesthetic adjuncts. Now we will discuss general anesthesia. General anesthesia includes general anesthetic drugs. General anesthetic drugs are the drugs which cause reversible loss of all sensations and consciousness. It usually involves a loss of memory and awareness with insensitivity to pain stimuli during a surgical procedure. For general anesthesia, we need unconsciousness, amnesia, loss of sensory and autonomic reflexes, and need of muscle relaxation. The drugs used for general anesthesia includes intravenous anesthesia. The most commonly used gold standard intravenous anesthetic drugs are thiopentone and propofol. There are others which includes etomidate, benzodiazepines and ketamine. Next we have inhalation anesthetics used for general anesthesia, which includes isoflurane, sevoflurane, dexflurane, halothane and nitrous oxide, which is a weak inhalational anesthetic. Another part of the general anesthetic is analgesia. Good analgesia is equal to good anesthesia. If you have a good analgesia, then you will produce a good anesthesia. Further, moving on, we have opioids, local anesthetics, NSAIDs and paracetamol. These all are included in analgesics. Gold standard opioids includes morphine. Then there are synthetic agents, pethidine. Others are fentanyl, alfentanyl, short actings, and remifentanil is ultra short acting. General anesthesia includes muscle relaxation. Muscle relaxation helps in intubation, helps surgeons and surgery of long durations, and reduce करते हैं maintenance dose of anesthetic agents की maintenance dose को भी muscle relaxants जो हैं वो decrease करते हैं. Muscle relaxants are of two types: depolarizing muscle relaxants and non-depolarizing muscle relaxants. Depolarizing muscle relaxants include succinylcholine, and long-acting muscle relaxant includes atracurium, rocurium, and vicurium, and also cis-atracurium. Now moving on to phases of general anesthesia. General anesthesia phases includes induction, maintenance, and recovery. First, we will discuss induction. Induction includes intravenous agents. Inhalational agents are usually for children or needle phobic patients. Induction includes monitoring, pre-oxygenation, which is the main part of the intubation process, analgesics and relaxants, masks, LMA, laryngeal mask, airways, ETT, endotracheal tubes. Maintenance of general anesthesia includes intravenous or inhalational agents, oxygen, 100% oxygen mostly, nitrous oxide, muscle relaxant, and analgesia. Recovery includes turning off the inhalational agents, reverse the relaxation, muscle relaxation, cuff reflex, extubate the patient when the patient is awake. Recovery position is very important. Monitor until the patient discharged. Now moving on to regional anesthesia. Regional anesthesia includes spinal anesthesia, epidural anesthesia. There are two types of regional anesthesia: neuroaxial and peripheral nerve blocks. Neuroaxial anesthesia includes spinal anesthesia, epidural anesthesia, and the peripheral nerve blocks includes the blocks. The blocks are Bayer block, plexus block, and selective peripheral nerve blocks. There are two broad forms of regional anesthesia: peripheral blockade and the central or neuroaxial blockade. Peripheral blockade inhibits sensory perception in an isolated part of the body, such as numbing a tooth for dental work or using a nerve block to inhibit sensation in an entire limb. On the other hand, central or neuroaxial blockade administers the anesthetic in the region of the central nervous system itself, suppressing incoming sensation from nerves outside the area of the block. Examples include epidural anesthesia and spinal anesthesia. Next, we have some uses of regional anesthesia. Regional anesthesia provides anesthesia for a surgical procedure, provides analgesic post-operatively or during labor and delivery. Therapy for patients with chronic pain syndrome such as cancer. Next, we have the third type of anesthesia, that is spinal anesthesia. Spinal anesthesia is also called spinal block, subarachnoid block, and interdural block, is a form of neuroaxial regional anesthesia involving the injection of a local anesthetic into the subarachnoid space, usually through a fine needle. These are the spinal needles of different lengths and different colors, like orange, purple, black, yellow, and pink color. Spinal anesthesia is usually performed by inserting the needle between the L3 and L4 space, the lumbar region of the spinal cord, and sometimes into L4 and L5 in order to avoid injury to the spinal cord. What are the indications of spinal anesthesia? Spinal anesthesia is indicated for the surgeries involving lower half of the body, like upper abdomen, lower abdomen, perineum, lower extremity, and is also indicated in obstetrics, cesarean sections, painful diagnosis. Spinal anesthesia, usually the drugs used in spinal anesthesia are bupivacaine, lidocaine, and tetracaine. Most commonly used is bupivacaine. The techniques used for spinal anesthesia is the sitting position and the left lateral position. And the puncture sites are interspaces between L2 and L3, L3 and L4, and the last one is L4 to L5. This picture is showing the positions for spinal anesthesia. The first one is lying position and the second one is sitting position used for spinal anesthesia. Next we have epidural anesthesia, the second type of neuroaxial anesthesia. The indications for epidural anesthesia is cardiac diseases, pulmonary diseases, and when the general anesthesia and spinal anesthesia is contraindicated, painful condition post-operative pain relief के लिए भी जो है epidural anesthesia is indicated. Epidural anesthesia के advantages हमारे पास क्या हैं? Longer duration होती है, more severe disturbance of स्पाइनल एनेस्थीसिया की जो डिस्टर्बेंसेस हैं वो मिनिमाइज हो जाती हैं, गैस्ट्रोइंटेस्टाइनल कंप्लेंट्स जो हैं वो मिनिमाइज हो जाती हैं, कैथेटराइजेशन जो है वो मिनिमाइज हो जाती है और लेस रेस्पिरेटरी इफेक्ट्स होते हैं. नेक्स्ट वी हैव लोकल एनेस्थेटिक्स. लोकल एनेस्थेटिक्स जो है इज इंजेक्टेड टू ब्लॉक और एनेस्थेटाइज अ नर्व और नर्व फाइबर. Then there are different types of local anesthetics like lignocaine, which is short acting, bupivacaine, which is slow and long acting, bupivacaine hai, and the next one is prilocaine. Uses of local anesthesia is dentistry. Dentistry में local anesthetics का बहुत ज़्यादा use है. स्किन लोकल टॉपिकल जो इन्फेक्शंस होते हैं उनके लिए लोकल एनेस्थेटिक्स यूज होते हैं, पोस्ट ऑपरेटिव पेन्स के लिए एंड पॉडियाट्री के लिए लाइक ट्रीटमेंट ऑफ डिसऑर्डर्स ऑफ द फुट, एंकल एंड लेग. एंड लाइक द मैकिन्टॉश noted, for the surgeon the spinal ends with the injection of the agent. For the anesthetist it begins with the injection of the agent. Thank you for listening. Allah Hafiz.